Rosemary, thank you so much for coming in today
My pleasure.
and doing this case with us. I know that you have personal experiences as an individual who has a disability that has progressed in the last few years and has become more of a difficulty for you. So, and I also know that there's a lot of misconceptions in, I think, the general public, but more importantly for us, that nurse practitioners and healthcare providers have. Things that they believe to be true about individuals with disabilities, things that they do. So can you just give us an idea of some of the misconceptions that you see when you are out in public and in healthcare delivery settings?
I think in general, at least for post-polio patients, because we are both disabled and older, some really old. And this is a new phenomenon because previously I think they died younger. They just weren't as visible. You didn't hear about post-polio, certainly. And so that we are lumped automatically with old people who really have lost part of their mental capacity as well as their physical capacity. And that can be insulting.
And so what happens then is people sort of assume because you're in a wheelchair that nothing else is working as well?
Or if you're on a walker, or if you're in a scooter, that you're not really sure that they're able to manage that. I see worried looks sometimes just from people who are thinking, why is this woman out here when she should probably be home and safe? Well, we don't want to be home and safe all the time. We want to live.
Do you find that people tend to ignore your disability in the terms of, and I think probably particularly healthcare professionals, where it's sort of the elephant in the room? You have a walker or a pair of crutches and nobody ever says, are they yours? And, and why are you using them? What do you need them for?
Now living in a retirement community, we don't really have a family doctor. We have an MD who is assigned to me, plus 150 other residents.
Right.
And they just don't know us in the same way.
Okay.
And my first interview with one of them was, you must get more exercise. You really, how much do you walk every day? Well, not too much because of this and that, Well, you should at least get 15 minutes exercise walking. Even as I was leaving the office, he was telling me how much I should walk.
So really no real thought about the fact that even though clearly you were using a walker and that you have a history of post-polio, that there was no thought about, adapting the plan to the patient. It was about everybody needs 15 minutes a day.
Everybody needs to walk, and no suggestion you see the fitness director, that you use the pool. None of the really acceptable things that I've worked out myself and with help.
Right. Do you find that people make an assumption that because you're using a walker that you must have had a stroke?
I do. I have had that asked many times, and I laugh when they ask me whether I've had a knee replacement.
That's it. Right, that's another one that would give you a walker.
I wish I was a good candidate for that, but no, that's not. And I usually, say, oh, polio when I was a child. It's worse. That's the short version.
So really there's one of the really important pieces is that someone actually asks you about the disability, in your case the post-polio and the fatigue and the weakness, that actually asks you about that disability and then looks at, based on your disability, what is it that's going to work best for you, and how can we adapt whatever it is that we need to be thinking about. Because one of the other issues I know that comes up frequently for people with disabilities, regardless of whether it's a cognitive mental disability or whether it's a physical disability, is the fact that they don't get routine health care and routine screenings, things for women like mammography or pap smears, those kinds of things. So that the question coming from the nurse practitioner or the healthcare provider about how can we best get you this service or get you what you need or how are we going to do this. I think another thing that you've mentioned to me in the past is the piece about we as healthcare providers, I think, tend to forget that you live with whatever the disability is every single day, and are often a much better expert
That's right.
on your disease. Certainly you're a much better expert on post-polio syndrome than I am. And to ask those questions and utilize the patient.
I hope I have educated a few people in my mini doctor life to let them know and help them to understand too, you know, that I'm not defined by my disability. It certainly defines a lot of different parts of my life, but it doesn't define me.
Are there one or two things that you think every healthcare provider, every nurse practitioner should be aware of, should know, should think of when it comes to working with any individual with a disability?
I think it's the same as with any other individual. See the whole person.
Okay.
Hear their physical complaints and listen to what else you hear, because that will make your conversation and your dialogue so much fuller.
So it's really that listening piece
bet.
and listening in the context of the individual and their
That's right.
disability.
That's right.
Okay.
I think so.
Thank you very much.
You're very welcome. It's a pleasure.
Thank you.